Hi, my name is Nur Suhaiza binti Kaharudin and
I'm Nur Alia Shazwani binti Alwani.
we are staff nurse from Mount Miriam Cancer Hospital, Penang. Today, we will share some information regarding implanted port care. I will introduce what is implanted port and
I will continue with information on how to take care of your implanted port once you're at home.
what is an implanted port? Implanted port is a medical device inserted under the skin. It is a type of central venous catheter. The function is to inject the liquid directly to the vein as a part of the treatment. How implanted port is in place? It is a minor procedure under local anesthesia. The procedure is performed by interventional radiologist or a surgeon. The procedure is completed within an hour. The port consists of two parts, the portal and the catheter. The first part is placement of the port. The port is usually inserted under the skin about 2 to 3 centimeters below the collarbone. You may feel a round or triangular shaped bump on your skin where the port is placed. The middle section of the port is called septum or access site, which is made by a self-sealing rubber that secures the port needle. For any intravenous treatment or to take blood sample, an oncology nurse will place a special needle into the port septum. The second part is the port catheter. The port is connected to a thin flexible tube called a catheter. The end of the catheter sits at a larger blood vessel which leads to the heart. The fluid or medicine flows directly through the catheter into the bloodstream.
For the first 24 to 48 hours after the procedure, the area around your incision will be tender, slight redness or bruised. You may also feel sore and swollen around the area, which is normal, but if the situation prolongs or you start to have fever, pain, bleeding or swelling at the Chemo-Port site, immediately call and inform your doctor. After the procedure, you will get the manufacturer's identification card about your port. This card provides details on the type of port that was put in. Do keep this card with you at all times. If you are staying in the hospital, the nurse will assess and monitor your port incision site. Implanted port can be used immediately should there be no complications. Keep the transparent gauze dressing for 7 to 10 days after procedure. If the dressing becomes damp or any discharge from the incision site, you need to return to the hospital to change the dressing. Do not do any strenuous exercise or activities that involve reaching or stretching your neck and chest area. Lifting of anything heavier than 5 kg, any forms of contact sports such as rugby and football. You may take shower, but try to avoid the incision site from getting wet. For female, avoid putting pressure on the incision areas such as wearing suspenders or a tight bra for the first 1 or 2 days. A port can stay in place as long as you need it and it is working well. This can be several months, years, or longer. If your port is not being used, it needs to be flushed monthly or maximum 3 monthly. Once your treatment is completed, your doctor will advise when to remove the implanted port. We hope this video is informative to understand more on implanted port. Thank you.